All right, good afternoon, ladies and gentlemen. Good afternoon to everyone who is joining us. Welcome to episode 7 of the Fleri Care Digest. The Fleri Care Digest is an opportunity for African immigrants in the diaspora to learn about the leading healthcare providers on the continent who are partnered with Fleri to make it possible to find quality healthcare for our loved ones back home. My name is Sam Badu. I'm the founder and CEO of Fleri. Fleri is a digital family care application that helps Africans living in the diaspora to easily find and pay for healthcare for their loved ones back home. Fleri is currently available to Africans living in Europe, Canada, the US, and currently covers those with families in Ghana, Nigeria, Zambia, Zimbabwe, Kenya, and the Gambia. Today, we have the pleasure of welcoming Mr. Patrick Ananunu, founder and CEO of Express Med Healthcare. Express Med is a digital first healthcare provider supporting preventative healthcare access and elderly care services in Ghana. Patrick, welcome very much to the Fleri Care Digest.
Yeah, thank you, Sam. Thank you, Sam, and the team. I'm happy to be here. I've seen the previous episodes. That was like, when is he putting Express Med on, man? So it's exciting to be here. And I must say that before we start, Fleri, you guys are doing a wonderful job back here in Ghana. I've been to some hospitals and I've seen notices. I've not told you that, but some hospitals have actually made clear notices for your beneficiaries. So for Fleri card holders, when you come do ABC, and I thought that was impressive. So you guys are doing a good job. Yeah.
I definitely appreciate you pointing that out. It's been an interesting journey, one that's about to get even more interesting in the months to come. But Fleri is not itself a healthcare provider. We are because of people like yourself. Um, it's a very interesting mindset to think and bank on collaboration as a winning factor. One of the things that we get asked all the time is, at some point in time, do you want to be an insurance company? At some point in time, do you want to have your own healthcare, services? At some point in time, do you want to have your own hospitals? And it speaks to the limiting mindset, certainly a possibility, but on a continent where there's so much latent capacity, amazing people with ideas who are building to change the future of Africa, we have very few players who are actually building to enable the growth of these companies. And for Fleri, we're betting on the ability to help the African healthcare provider access greater markets, actually grow revenue, and be able to reinvest in a better, healthier economy for the Africans that we say we love. And so it's definitely been a pleasure, and part of the journey has been with you. Um, I want to start with a proper introduction to
Okay.
you. Who is Patrick Ananunu? You know,
Yeah.
how did you end up starting Express Med Healthcare? Why Express Med? Why do you do the things that you do? I want you to share that with the listeners.
Okay. All right. Thanks, Sam. So my name is Patrick Ananunu, founder of Express Med Healthcare. Uh, I didn't wake up one day to form Express Med, no, and I didn't have health on my fingers, no, from day one, no. But over time, over 7 years, I first found myself doing my year service or community service in a hospital. So I happened to be in the administration where I got a hindsight of all the processes, the administrative work within a public hospital. And so it still didn't click at that point, even though there were challenges in the health sector, but it was service as usual. Then I moved into a private hospital where I was the hospital manager or administrator, as you call it. And so there you have access to the data, to the books and the complaints. And every day when you come and stand at the reception and you look at the queues, even for a private hospital where we emphasize quick service, quality, and all that, you still can't get away with the queues, as you may know, inadequate infrastructure accessibility in the Ghanaian health sector. Then you look at the data. Okay, so I just happen to look at the data. Then I look at the age. So now you chance on the trends. So you see the number of people with chronic conditions who come in periodically and just sit in the queue. Now they spend more time in the queue than they spend with the doctor actually. Yeah, because of the next patient. And then they only take refill or do some labs and then go back home. So I started talking to the doctors. Can't we do anything about improving the time of service here? Then he said that, well, for some of these patients, they do not necessarily need to come to the hospital. Yes, for some, there are emergency cases, yes, but there are some that we can easily see them at home or send their medicines or just do some quick labs and then talk to them that they are fine. They need to do their next diabetic check in 3 months or so. So these are the sort of questions that I started having with the medical professionals. Then we got interested in running it. So how about we now take this part of the healthcare where the patient doesn't necessarily need to come to the hospital, but rather have an initial, it could be a quick phone call or appointment or
So, ladies and gentlemen, this happens, and it's part of the terrain. Working across borders can be its own journey. It can be interesting in its own way, but one of the things that we have to deal with is um, internet outages, which also points to the large part of the opportunity that exists to be able to build more affordable, reliable internet solutions for the continent and other emerging countries. We will hold on while Patrick gets connected again, but while we are here, we might as well talk about the work that they're doing. So, for a lot of people who I know who are from Ghana, um, because I am from Ghana, if you hadn't figured, um, there's a big challenge as our parents start to age around who's going to take care of them, you know, and that challenge that continues to come up is exactly the one that today we are going to address with Patrick. So welcome back, Patrick.
thank
I
you.
was just talking about how we need a lot more Elon Musk investing in quality internet access. Um,
Uh,
yeah, but if we're not healthy, of what use is the internet to us? So tell us a bit more about the circumstances that led to you getting involved with ExpressMed.
yes, thanks, Sam. And sorry about the internet instability. So it was more of the problems that we identified in the healthcare service delivery process. Okay, albeit the long queues, the shorter time with the doctors, insufficient accessibility, yes, and then infrastructure. So some of these challenges, then we decided to see how best we can support the hospital system. So together with a few doctors, we decided to test the model somewhere 2019 to see how it works. And so for the patients that we look at their data and we think that maybe for your next visit, how about you book an appointment with a doctor so that the doctor comes home to see you? And we tried that out. Initially, it was a bit new, but when we started, they realized that, oh, it's even more convenient. It's the same doctor that I would have come spend maybe 5, 10 minutes with that I get to spend 30 minutes plus. And now they started talking to their friends and loved ones that You can actually see the doctor at home. Then they started making other requests. How about labs? Can you also come and do labs? And yes, we tried that. And with time, we came to understood the market and now started rolling out our home care and then our telehealth packages.
You know, there's nothing more enjoyable or beautiful to see than to realize that, an idea has met its time. And I'll be frank with you. Like, I lived in Ghana, grew up in Ghana, right? As you probably know. When you start talking to people about, oh, what if the doctor came back home to see you, right? We have this mentality that, well, if I'm sick, right, then I need to go to the hospital. Is it the
Yeah.
same thing? Is the value the same if I'm talking to the doctor over WhatsApp or over Zoom or over Skype? Um, and it's been interesting to see you build your own business on this really interesting premise that Africans are no different or less open to convenience than other people, right? And if you do provide value and quality and you treat them with the dignity, right, that they deserve, you will realize that you would be creating your own market. And so it's been such a pleasure to see more and more people say, yeah, I actually prefer for the doctor to come home and come and see me. After all, there's all of this traffic, there's all of this, waiting, there's all of these things that happen, right, that actually hold us from being able to give the care that our folks deserve. So hopefully Patrick is going to be able to join us and then follow up with the other questions. But it's been really phenomenal to see how ExpressMed has grown. There you go, Patrick. So moving on from that question, I wanted to ask you, what have you noticed, right, in the last few months, in the last year? Tell us about the trends that you're seeing. What are you going to the homes to go do? Is it folks with diabetes? Is it for preventative care? What are people actually asking for doctors to come and do in their homes?
All right. That's a good question, actually. So, one of the trends that we've identified is that people or patients are moving from a treatment-based healthcare to a more preventive approach. By prevention, we are looking at three main things. We are looking at education and awareness. Realize that there is actually inadequate health information in the system. People are not much self-aware of their health status or health situation until or unless they do a checkup or they run into trouble. And so the first year, which is the lack of education and access, is one need among clients. Then another need is early detection of diseases. Generally, you do a survey, we do periodic surveys, and you ask people if they know their health status as we speak. No, they don't. When last did they do medical checkup? They have no idea. Do they think they are healthy? They tell that yes, they live by faith that they are healthy. And so, yeah, so that was one gap that we saw. And then the last stage of prevention, which unfortunately most Ghanaians are in this category, is the treatment and management of chronic diseases. And so whereas majority of healthcare providers have focused on this last stage, which is treating you when you are sick or managing the diabetes or hypertension or stroke, there are actually precursors that we can follow to reduce the rates at this third tier. And if you look at the statistics, it will shock you. About 43% of deaths are attributable to non-communicable diseases. Whilst some 5 years back, it would have been older people 60 and above suffering from surgery. Now it's actually 50 and below. 50 and below, they are actually attracting such illnesses. And so these are key trends that we sought to address. And so we looked at the holistic model where we take the patient through one, a lot of education and awareness, a lot of sensitization, and then we do periodic medical screening for them at their convenience, where if we detect early signs or illnesses, we can put in the interventions and management to reduce the rate at which people get such chronic diseases. So that is one key trend that we can look at. Another trend, if I may, is the growth in virtual hospitals. COVID changed the health sector a lot, and it actually moved face-to-face consultations to what we have now as telemedicine or telehealth. Even though COVID is relatively stable and we seem to be in a safer place now, telemedicine is still it's on a growing trajectory. And so people will prefer to have an early consultation with a doctor or physician, or after some labs at home, they do not have to come and see you for the analysis. They can actually have a call with you to run the analysis. Another trend we've seen is what we call retail healthcare. I think Amazon, Walmart, and here in Ghana, companies like M-Pharma are starting to venture into that space. People are tending to move from the traditional healthcare system to a model where they can easily and quickly have access to their medications or healthcare. But these are general trends. But for us specifically, we are looking at the virtual healthcare system, including a telehealth and home care, and then the need for us to put patients from early detection of diseases to the management of chronic diseases.
Yeah, this is extremely helpful. And one of the things that you mentioned, which is alarming, because I think about myself, right, as a clear example. This shift of, you know, preventable lifestyle diseases from the elderly to relatively young by measure, um, is it makes me panic, primarily because if you look at the statistics that we keep talking about, right, that Africa's population is the youngest globally, that the future of the world is going to be in Africa. If we're not actually ready, healthy, and available to take the opportunity, we might lose out. But even more so, as work becomes distributed and work becomes increasingly over the internet, more and more people will be shifting towards independently driven work lifestyles that usually leads to people becoming more and more like me, sedentary for the for the most part of their day, sitting behind a computer, working 12, 16, 18 hours a day, right? Just sitting. How does solutions like yours, right, increase the awareness,
Yeah.
um, communicate differently, right? Because I'm guessing, you know, I'm slightly older than you, but how are you communicating healthcare differently, communicating awareness, prevention differently, right, from the older generation in a way that people become more conscious, even as their convenient options increase?
All right. Yeah, that is a good one. And we realized that as a growing business, we had to adapt different communication strategies for different uh, customer segments. For the older populace, we realized that honestly, they are not too familiar with the technology bit. Yes, they are still a bit used to the traditional approach. And so for them, we go to them. Yeah. And so we have devised um, flying nurses all around where we have time to take these clients or these older population through what we call our comprehensive packages. And so for these clients, we introduce them to a yearly package where one, they have access to initial doctor consultation just to try to understand who they are and their medical history a bit more. And then we now do a set of basic labs for them. Yes, we do a set of basic like we check their BP, their sugar level, their cholesterol level, check their liver, and a few urine analysis. to have a sense. For those 40 and above, we do prostate as well, just to have a sense of their medical condition. Now with this data, we are able to share it with them and say that, all right, daddy, all right, mommy, from the analysis that we did, you are healthy, you are okay, but these are red flags that we have to pay attention to. But lucky, we can start putting you on some medical intervention. We can put you on some periodic home care. We can put you on these medications or these dietary management or physiotherapy services. And so once we're able to give them that evidence through the initial lab test at their home, at their convenience, and perhaps affordable, they understand that this is the situation that they are in. And so if they are to follow these instructions, then it works hand in hand, it works for them. The good thing also is that we do not leave such patients in isolation. We always assign a medical doctor or a medical team to such patients. So for the other populations, you always know that we can always talk to Dr. Badu, we can always talk to Nurse Patrick, because they are the medical team assigned to me. So there is that comfort and convenience and that reliability on our services. And that's how come we're able to push such services to them.
Okay. Help me understand how your services today, right, giving the people that are using it, are translating across to a lot of people who could not afford it previously, but are now, asking to get your services, and someone else is going to pay for them. I want you to talk me through maybe the two sides, right? Because there are Ghanaians today who live in maybe Accra, but have family in Pokwase or Navrongo or maybe Sekondi Takrade, but want to pay for them, right? And how do we, or how are you looking at this trend feeding or bleeding over to, folks like Fleri's customers who are also considering, how do I ensure that my mom is taken care of while I'm here hustling, doing whatever I need to do?
Okay, that's a good one. And to start with, let's start with Fleri. So over here at Express Med, we realize that majority of our payers are in the diaspora. And so there are people in the diaspora who want their parents attended to. Okay. So now when Fleri came into the picture, this is what happened. They were initially paying money, sometimes indirectly to us, and sometimes the money never gets to us on time after a service has been rendered. But now with Fleri in the picture, all that they do is that Fleri manages the transaction, Fleri manages the appropriation of these resources or funds. And so for the payers or guardians in the diaspora, one, what they know is that they have expressmen looking after their mom on time, and they get to also talk to the doctor or the medical team to have hands-on experience of how their parents are doing. And so whenever a doctor visits, they have a call, sometimes video call with these payers for them to see how service is being rendered. Medical reports are also shared to them. But then there is also a third party to check, that is Fleri. So they have like double assurance, and they do not necessarily have to rely on their cousin or external relative. They have Fleri who checks to make sure that what they are paying for is being done and being done on time. The monies that they are sending are being done on time. And so for our clients in the diaspora, this service really works for them because they know that somebody spends good time with their parents. And when they see the result, they tend to see improvement over time. It's a bit different for payers in Ghana. They are here, even though their parents can be in Accra and they will be in the eastern region. They really want to sometimes be there.
Okay.
Yes, they really wish to be there. And so they can book the appointment and pay in advance, but they are going to tell you that I'll be in Accra next week, Saturday. Is it possible that I come there and the doctor comes and I also get to talk to the doctor? They just want to have that family, experience for their parents. And so that is, yes. And for them, they do not have somebody like Fleri who can do that check for them as well. And so that's a little difference that we see serving clients in the diaspora and serving
Mhm.
clients here in Ghana.
Yeah, I was gonna ask you if it was primarily due to a lack of general trust that we have, but I think you answered that in pointing out a key part. Today, the experience for healthcare is largely transactional. People go to the hospital, they pay some money, but they don't actually get the experience of, like, doctor, what is really going on, right? This thing that you're telling me, you
Yeah,
mentioned benign, you mentioned some other plenty English, and I don't really know what it is, right? Most people aren't even able to ask, and if
yeah,
you've had like some of my experiences, some medical professionals can be quite dismissive, and
yeah,
the experience isn't always fun. Having a doctor in your home where it feels like, when I about me fear, right?
yeah, yeah,
Yes. So I have some degree of control
yeah,
over the way that we interact and the questions that I ask you. And it changes the mindset into what it always had to be, which is the medical professional exists to serve you in a way that promotes your well-being and health, right? Versus the skewed version where it feels a lot like our medical professionals are doing us a favor, even though we're paying for the care that we're getting, right? And I think that is a key part of your answer that stands out. That it's not really because they don't trust you; it's just because it's a different experience of having a doctor in your home, especially if you're Ghanaian and you know how they value being a doctor, right? I know my mom would give anything
yeah,
for me to be a
yeah,
doctor, a pastor, you know.
yeah.
But we're happy to be able to understand what that looks like. Tell me a bit more about your team, the composition of the team, and the reason why I ask
Okay,
this is as we represent you, we know a lot, but for those who are listening and who are in the diaspora, they're probably wondering, what are the qualifications of these people, right? Where did they go to school? Who are they working with? Are these doctors? Are these, nurses? What is the composition of your team and who is doing what?
all right. So, as we've mentioned, we provide home care services.
Yeah.
But home care services come in different parts. There is the part where the doctor comes to see you at home first. But this is the composition of the team. We have qualified medical doctors. Before a doctor is recruited onto our team, you go through a certain rigorous process. One with Ghana Health Service, another with HIFRA, Health Regulatory Authority Agency,
Yeah.
check your, and all our doctors need to be practicing doctors. So you need to be affiliated to a typical traditional setting where you
Hmm.
are practically working all the time. And so, uh, to put it in quotes, we do not work with unemployed doctors. Okay, so all our doctors need
Yeah.
to be practicing doctors. Yes, it's very important for us that you learn on the job every day. And so once you're
Hmm.
able to meet these 3, 4 criteria, then you now come to practice our system. You also need to be tech savvy, but that we can always train you on it. Okay, and so the medical team, you must make sure you meet all these certifications, have a certain level of experience, and be willing to understand that this segment is different. In
Yeah.
the home care setting, you need our staff need to understand that you have to spend more time breaking down the services to the client. And so if it is labs, try to break it down to the barest minimum. What is hypertension? When you say your BP is high, what does it mean?
Hmm.
When you say urine analysis, what does it mean to that 70-year-old who doesn't understand? And so that is very important for us that you take time to understand it. And so if you've realized most of our doctors are able to do a bit of a multilingual, so
Hmm.
they can speak
Yeah.
English, and speak Gan, speak Chifanti, and 1 or 2 other languages, so that depending on the language that the patient is more comfortable, you can easily flow and help them understand. And this is not just the doctors, it also runs through our nursing. because our home care also includes nursing home care. There are some patients who are bedridden or have stroke or arthritis, difficult mobility, that we assign nurses to them. Either they stay with them 24 hours or they run 12-hour service with them. You need to make
Yeah.
sure you meet all these criteria, all these regulations. Very important for us. Your pins need to be renewed, your location and address, your guardian, and these are all also certified by the patient. Same with our lab services. Our lab services sometimes go through 2 or 3 tests because you can have instances where you need to double check the labs.
Mm-hmm.
Yes, you need to double to be very sure that the result that you are getting is accurate. And so our lab, we do periodic diagnostic visits. We work with authorities, they check the equipment you work with, they check the
Mm-hmm.
personnel, they check their safety protocols and all that to make sure that it is on point. But there is nothing more devastating as giving somebody wrong lab results.
Yeah.
And so, yes, that is very important for us. And so, before these results are even in, you would have gone through 2 or 3 phases before the doctor even looks at it. And now also does is our assessment. So each of our medical staff go through that rigorous process, which gives us a certain level of peace of mind. So we barely have complaints.
Yeah. Yeah.
Yeah.
Because we don't want to end up with the Tyrannus here, but I think there are comments in there. Latosha is asking, how are transitions of care managed when the client leaves the hospital? So in this case, when the beneficiary leaves the hospital, um, how do you transition care management for such a person?
Okay. Yeah. That's a good one. This was a challenge when we started. We were trying to work in isolation. We realized that wasn't going to work. You still need to collaborate
Mm,
with the hospitals. Yes. And so what we now decided to do was that once a patient leaves the hospital facility, we contact
mhm,
the doctor, either on phone or through the patient, that we are taking over from the survey where you ended, or we are
yeah.
continuing the service provision. And then we have had instances where doctors at Kolebu have also asked for our medical reports to also
Mhm,
continue the transition. There were some patients who needed oxygen refill, which we couldn't provide at home, and we had to take to the
yeah.
hospital. And once the doctor requests for this one, and we're able to generate them,
Mhm,
that's them a lot of good because they now know where to continue from. And so documentation is very important for us. And we've also been efficient. We should also applaud the healthcare facilities who are also willing to also cooperate with us. That once we come in and say that we are home care providers, we are only continuing or supporting the service, maybe post-surgical review and issues like that we are managing at home,
yeah.
but we will need ABC reports so that our doctors can continue. So that's how we're able to manage patients who leave the hospital. You have to do that by working with the provider in the hospital first.
Okay, 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 okay. This is really, really great, Patrick. The idea of continuity of care is one that is so underestimated in that particular market. We've had a lot of problems across Africa adopting electronic medical record systems and unifying this. Um, as you talk about the movement of data, right? And I can touch on how Fleri is approaching that and why it's important that we're able to be the connective tissue between providers who today largely do not exchange information. But do you use an EMR yourself? Are you seeing more providers using EMRs? And how is the broader ecosystem around you, right, managing access to data and the sharing of data, right, in both a transparent, securitized way, but in a way that allows for life-changing support from one place to the other? How does that work for you?
Okay, so I'll one of the challenges is insufficient clinical health data in Ghana and
Mm,
Africa as a whole.
yeah.
However, I can also say that in terms of policy, there has been some progress. National Health Insurance, for example, NHIS, for example, as we
Hmm.
speak, they are going, they are moving towards 100% electronic submission of claims. And
Okay.
what that means is that if you are a healthcare provider and you attend to a number of patients within a month, you need to submit your bills for payment. Be
Hmm.
proud, you have to print them,
Yep.
bulk them, and then submit them. The deadline for that to cease is this year. So by the end of this year, if not next month or May, every hospital, so far as you provide access to patients with NHIS cards, you can't submit hard copies. And I think that is a great step. So now hospitals are being forced to either have their own electronic management system or NHIS will come and install their software on your computer. And so you tend to not have much excuse why now you can't submit the data. So let's assume that has been solved. Now the bigger problem is what do we do with the data?
Hmm.
What do we do with the data? And
Yeah.
that is where I think we need to start focusing on analyzing the
Hmm.
data to help in preventive medicine, pathing algorithms, drug discovery, vaccinations. And that is an area that I think that not just Express Med, not just another health, I think the whole Ghanaian healthcare sector might need a lot of support because we
Mm.
seem to be, yes, a bit behind in terms of analyzing and making informed decisions with the data.
Yeah, this is phenomenal to hear and also to see. You know, for us at Fleri, one of the big things this year that we're working on is tying into all of the providers that we have. Because prior to now, every provider works in isolation, right?
Yeah,
As Flurry's ecosystem is growing, we're starting to see people leave, Sierra Leone, people leave Nigeria to come get care in Ghana, right? They're traveling with printed documentation from their most recent provider. But think of all of the providers that they've seen in the months and the years prior, right? That history is essentially lost from provider to provider, right? And we're unifying this with the idea of a primary care physician, right? A virtual PCP that you experience on Flurry for every beneficiary, who is now an intermediary medical professional, helping to ensure that if you're going to see a specialist, right, you're getting a referral to go see the specialist. If you're going to go take particular medication, we're actually analyzing that with respect to all of the other medications that you've taken in the last year, right?
yeah,
Because
yeah,
today there's no central body or even any individual company that is actually looking at all of that. And so people are being killed by the wrong medication. People are being killed even with the right diagnosis, but mixing with previous medication that they had, right? Nobody is analyzing how many medications are you already on? Are there
yeah,
conflicts? Are there reactions to them? And I think this is going to move us forward significantly in being able to support that. I see here that Mr. Franco say is asking if you're open to working with other specialists apart from those that you've mentioned. So I'm not sure if that message is intended for just Flurry or for you as well. But it will be interesting to understand. Maybe we can address that. How do other providers get to join your organization?
Okay, I think that by providers, we are looking at two or more types or different types of providers. One, we are looking at individual service providers like doctors. So we are looking at specialists. We are looking at, even for nurses, we are really looking at diploma nurses, nursing assistants or degree nurses, or lab technicians. These are all providers. And so are we open to working with these individual providers? Yes. As we discussed earlier, we have a certain protocol that we also follow. And so we are very much open to collaboration. We are very much open to working with a lot of medical professionals because also our service is not just in Accra. And once in a while, when you get service outside of Accra, you need the right personnel to also work with. And so on the individual level, yes, we are very open. And at the firm or micro organizational level, we are very open to that as well. What we have been looking at is partnering insurance companies. Here in Ghana, private insurance companies. As you are aware, there are a lot of clients already on private insurance companies. And so sometimes the dilemma is, do we pay extra for home care, which is not covered by our insurance company? Or can you come see me and my insurance company will reimburse that? But that is a long talk that we are currently still working on. So we are very much open to collaborating with service providers across all sectors. Then before that, you were discussing data before that. So I just wanted to add an example. Yes, and it was a good point that you raised. You see, one challenge that recently, I didn't know of this, that the healthcare system in Ghana itself lack what they call a client complaint protocol procedure. I'm sure in the States and UK you have that. Here, when you want to launch a complaint, what is the protocol? As we speak, it is non-existent. And I was shocked. And this is because a patient lost a family member in a large hospital. Unfortunately for them, this guardian also happens to be a medical doctor in the state. And so they wanted to, can we just probe further to see the trail, just to see what happened? They got the data, but they can't launch a complaint. There isn't much follow unless the usual, I want to see the boss, or send an email and they never get back to you. And it is very shocking. Now you think that this problem is just at the service provider level, just at the hospital. No, the person now proceeds to the regulatory level and they also don't have. And so that is something that I believe that we can look into, not just us, but also big organizations like you and your other collaborators. How can we get policymakers to start putting some of these standardized industry practices in place to improve healthcare?
I can only imagine, and even through the conversations that I've had, the number of stories, the number of people who share their experiences of going back home, sending a mom, a dad, a grandmother to the hospital, and the
Yeah,
circumstances under which they have to get care, right? And there's no one to literally turn to, right? Imagine in every hospital that you go to, and sometimes we'll come across one or two people who will ask, oh, but why do I need Fleri to help my mother to go to the hospital when I have six sisters who live in the village that can maybe come and then take care on that end. And what you said is one of those key parts. It's the fact that the reality of going to a hospital in Ghana, right, requires you to know a doctor who works there, right? Requires you to know a nurse or a personnel who works there. Otherwise, you're going to be the last person that's seen. You're going to be less paid attention to, right? And these things largely happen because, think about it, the large majority of Ghanaians cannot actually pay for the care that they're getting. And
yeah,
so hospitals that are profit making businesses, right, are left to prioritize based on who they perceive can be able to pay, who they perceive is connected, and who they perceive, right, to be an important person, right, by their standards.
yeah,
And so what Fleri really does is to break that system of I need to know someone before my mom is paid attention to. Because Fleri
yeah,
partnering with providers creates leverage. right?
Yeah.
Providers
Yeah.
want to make money. The people who send the billions of dollars are in the diaspora. Your pathway to the diaspora is through Fleri. But Fleri gets to enforce the standards, right, and the protocols that should be established in order for providers to be able to deliver for their customers, right, for the patients who go there. And I think the critical role that we're discovering as we work with every provider is, you know, how do you handle customer complaints? If something goes wrong, what is the process for restitution? How do we correct those things
Yeah.
in that end? And so, yeah, like Latosha is saying, patient advocates are a big part of it, right? Patient advocacy is the primary role of the Fleri Family Care Manager, right? And the ability to do that for our patients or the beneficiaries of our loved one or of the immigrants here is a core part for why we exist and why we push this when we work with providers like yourself. But truly appreciate the insight on that end. I'm going to ask you to go through the plans that today, right, you have, and then your services. But before we dive into that, there's a critical part of what you do that I want to make sure that we address.
Okay.
Express Med doesn't just send people home to go take care of loved ones, for a lab test, or you fulfill a very critical need when it comes to elderly care, right?
Yeah.
My father is a typical example. My sister just left home. My brother is living out of home. My mom is working somewhere, you know, and he needs care more than ever. I remember when we started talking, when I came to Ghana last year and we're talking about this, having someone who can be home for 6, 8, 12 hours is critical. Sometimes
Yeah.
even having someone who can stay there 24/7 is critical. What is the role that Express Med is playing in the emerging elderly care scene and assisted living scenario in Ghana?
Yeah. Yeah. That is a growing area, I must say, assisted healthcare, concierge service. And for us at Express Med, what we've sought to do is now we've recruited a tall pipeline of nurses, trained nurses who go through trainings of different forms, picking different health scenarios and training them. We've partnered with an home care agency in the UK who also offer standardized training to these nurses as well. Because, as I mentioned earlier, majority of the payers are in the diaspora. And so sometimes they give you an American standard to a Ghanaian healthcare and they don't care. You still have to deliver once they are paying for it. And so what our nurses have come to do is that they've also come to understand these patients. But since last year, we've also seen a new trend. Even for living nurses, you can imagine staying with somebody for 6, 12 hours, how daunting it can be. And so here you have one nurse looking after a patient for 3 days, 1 week, 1 month, stay in. Realize that with time, the quality reduces. The quality of care, that passion and attention start to fade out. Not because they've lost passion in the job, no, because they are exhausted. And so the opportunity and the breakthrough we've had with having a tall pipeline of nurses is that now we're able to run shifts and rotate. And so for each patient, we actually assign about 2 or 3 nurses to you who all understand the same patient, able to properly hand over documentation, the care, the medicine delivery, the exercise, the mobility assistance, changing of catheters, uh, and what have you. Because realize that once you have a team assigned to a person, there's actually enhanced healthcare and improved well-being compared to when we had just one nurse looking after somebody, even though they were doing a good job, but the productivity over time wasn't that efficient for us. And so this is how we have been able to address that growth in or demand for nursing assistants, and now we've been able to capture or stabilize that market. Now we have a lot of trained nurses who are able to rotate and easily adjust to the patient's needs, and which is working quite well, I must say, especially for patients who are bedridden, patients who are just come from surgery, stroke patients, mild stroke, any form of stroke, and then they need regular physio services and nursing care, changing of diapers, wound dressing, and all these mobility assistants or nursing assistants, feeding, and we can't do nursing home care without negating the fact that most older people forget to take their medicines. And so, whilst there is automation, you actually need somebody to also enforce it to make sure that daddy or mommy takes their medication. That is, I think that's an intervention that nurses are able to offer our patients who are on our home care packages.
Yeah, thanks a lot for breaking that down. Really helps to think about like the space itself, the need for certification, the opportunities that will come in standardizing certification and meeting even higher certification. But talk to us finally about the care plans that you have on Fleri today. What should people expect to see on there? What should they be seeing? What do these plans cover? Walk me through your plans today.
Okay, okay. Thanks, Sam. So, first off, I'd like to say that our partnership with Fleri has been a good one. Being able to offer healthcare to beneficiaries or people who have signed on to Fleri. It's also giving us access to the diaspora market, and we are thankful for that. But in terms of services, we've developed, based on survey with our clients, we're able to develop some packages for our clients on Fleri. And then we have services such as acute conditions. And our services are broken down into quarterly, monthly, or yearly payment plans.
Hmm.
And so each service comprises periodic doctor home visits. And so there is that flexibility for a patient to say, okay, I would like to see the doctor maybe every quarter as compared to every month. There is that flexibility. So there is a doctor home visit, and then there are two medical checkups or three or four medical checkups within a year. And so, because we are really heavy on preventive medicine, we believe that regardless of the package that you want, we need to do some medical tests to assess you
Hmm.
well, to know how we can manage you properly and which medical team to actually assign to you. And so, for a typical package on Fleri, you have your home visit, you have your periodic medical checkups or screening, and then you have telemedicines every month. And
Hmm.
so every month you're entitled to a number of consultations with the doctor virtually.
Yep.
Within a month, yeah, 2 weeks, you can just call in and then talk to a doctor about any acute or any medical issue, any reaction you are having with the medication or something of that sort. It is all part of the package, and you do not have to pay extra for that. Then there are also clients who have also added on physiotherapy and dietary management. And so there are
Hmm.
others who really have, especially patients with high cholesterol or bad cholesterol, we need to manage their diet. And so there are packages for patients who need such dietary services as well. And then what we just spoke about, the nursing packages for those who do not have a family member looking after the patient or their guardian, or they are busy or do not have the necessary medical skill or know-how, there are the nursing packages that the patients can always sign on so that we can have nurses assigned to their loved ones. And so these
Hmm.
are the key packages on Fleri that have been made so flexible and very accommodating for every patient in the diaspora to hook on and sign on to any of them that they find necessary for their guardian or loved one.
Really helpful to point out those plans, right? And I think before we end, it's important to take a minute and appreciate the fact that young people are taking into their hands solving the problems that we've seen for generations, right? Um, I remember when I was growing up in Ghana, every time I'd get sick, right, my mom will have to stop whatever she was doing and take me all the way to a shaman because Dr. Nunu, interestingly enough, and I haven't told you this, but my family doctor was Dr. Nunu, who had
Okay.
yeah, Nunu Clinic in a shaman, and so we'll go all the way there. If I was going to be admitted, um, you know, I'll have to be left there. And I look at this experience, right, and how different it is for the generations of people that are coming up, primarily because of people like you. Um, it's very, very real. It's very, very tangible. More often than not, we think um, telehealth or home health care is the thing that people access when they have all of the luxury in the world, but it's the realization of what our society is actually made of. You know, the large majority of the African society is led by women who are entrepreneurs, right? The large
Yeah.
majority of families are managed by women who are entrepreneurs and building and doing whatever they can to support their families. Um, the services that you provide allows for families to be able to get some decent amount of time, be dignified in their care, save hours as if the traffic is not enough, right? And it's really important for us to really ground ourselves and understand what these innovations and different ways of doing things and the way that we actually are imagining or reimagining life for the Africans that are coming up, for the Ghanaians that are coming up. Um, it's not possible without people like you. And I feel honored to be associated with your work. I feel honored to be associated with the care that you're providing. I feel honored to be able to represent you every single time we talk to someone in the diaspora to point at Express Med as being one of the providers that you can trust to take care of your family back home. Patrick, it's been a pleasure having you on here. It's been a pleasure hearing more. And as people watch in, Patrick Ananunu is the amazing founder of Express Med Healthcare. They are a digital first healthcare platform providing preventative healthcare access to families living in Ghana and elderly care for those who need it. They're supporting a better life for Ghanaians living in the diaspora by making it easier to gain that peace of mind without having to send money, not know where the money is going to, not know how it's being spent, not getting a thank you when the care has been consumed. You're reimagining life, Patrick, and Fleri is proud to be partnered with you.
Uh, Thank you, Sam. Thank you, Sam. It's an honor to also work with Fleri. It's been a good journey and smooth one, and it's also always a privilege for the medical team to also associate with the Fleri brand and also have a good interaction with beneficiaries of Fleri. And I see that there is still a lot for us to do. There's still a lot of untapped opportunities for Fleri here in the country and in Africa as well. And we are really also positioning ourselves so that we can work with you all the way. I
Oh,
already see that you're doing something in just before you close, something on mental health in Nigeria thereabout.
yeah.
And so one of our medical doctors drew our attention to the fact that we have a lot of young people booking for depression and mental health issues on our telehealth platforms. And they've already seen that you were doing some work in that space. So before the call, I asked them if they want to start to chip in something. They said that yes. They were also hoping that you can replicate some of these mental health advocacies that you were doing in other African countries back here so that we see how we can collaborate and work on them. Fortunately for us, the government of Ghana this week decriminalized attempted suicide. So before, if you attempt to commit suicide, it was a crime. But now they are seeing it as a mental health issue that needs attention. And we think that that is a great step in the right
Yeah.
direction. And so kudos to some of these interventions that you put in. And we're always willing to work with you all the way. So yeah, it's good to be
Yeah.
here. Yeah.
Yeah, I really appreciate it. I think you should expect that at least Nana will be reaching out pretty soon
Wow.
as we work on it. This coming month has some goodies out for us, so we're really looking forward to working more with you.
Great.
So yeah, super excited. Thank you so much, Patrick, for making it.
Sure. Okay.
For those of you watching, listening, it's been episode 7 of the Fleri Care Digest, where we dive into the founders, the operators, the leadership of the healthcare providers that are partnered with Fleri, making it easier for Africans in the diaspora to access better quality care for their loved ones back home, bringing them peace of mind and financial wellness. It's been Patrick Ananunu from Express Med Health here. Myself, Sam Badu. It's been a pleasure having you. Thank you.
Sure. Thanks. Bye.
Alrighty.